I am Dr. Leana. Welcome to our channel. And today I need you to pay attention to something most people flush away without a second thought. Your urine can change smell before pain, fever, or weakness ever appears. Sometimes it is harmless. Sometimes it is your body's quiet warning signal. In the next few minutes, you will learn the 5 smells that matter, the 3 mistakes people make, and the exact moment you should stop guessing and call a doctor. Now, before you panic, let me say this clearly. A different urine smell does not automatically mean something dangerous is happening. Many odor changes come from food, vitamins, coffee, medications, or not drinking enough fluid. But here's the shocking part. The smell itself is not the real message. The message is the pattern around the smell. Does it come and go? Does it happen after certain foods? Does it arrive with burning, pain, fever, weakness, thirst, or confusion? That is where the truth begins. Your urine is not just waste. It is a report from your bloodstream. Your kidneys filter your blood all day and all night, removing extra fluid, salts, acids, urea, medication byproducts, food chemicals, and metabolic waste. Think of your kidneys like a powerful filtration plant. Every minute, they decide what your body should keep, what should be balanced, and what should leave. When that balance changes, the smell can change too. And wait for it, because this is the first secret most people miss. Urine is mostly water, but the smell comes from what is dissolved inside that water. When there is more water, the odor is weaker. When there is less water, the odor becomes stronger. It is like making soup. If you add plenty of broth, the flavor spreads out. But if the broth evaporates, the same ingredient suddenly tastes stronger. Your urine works in a very similar way. That is why the first smell we need to talk about is the sharp, strong, ammonia-like smell. Many people describe it as harsh, chemical, or unusually powerful, and most of the time, this smell is not a mystery. It often means your urine is concentrated. The body is trying to save water, so the waste becomes packed into a smaller amount of fluid. Urea, one of the main waste products from protein breakdown, can contribute to that strong ammonia-like odor when urine is more concentrated. This matters more after 50. As we age, the body's water reserve can become less forgiving. The thirst signal may become weaker, and some people do not feel thirsty until they are already running low. Here's a real example. A woman in her late 60s notices her urine smells much stronger in the morning. She has no burning, no fever, and no pain. But she also admits she stops drinking after dinner because she does not want to wake up at night. That smell may not be an infection. It may be a warning that her body is spending the night too concentrated. Her kidneys are doing their job, but they are working with less water than they would like. But here is the part many people get wrong. The answer is not always to suddenly drink huge amounts of water. If someone has heart failure, kidney disease, liver disease, or a fluid restriction, they need guidance before increasing fluids. For most people, the smarter approach is steady hydration earlier in the day, small amounts over time. Water-rich foods, soups, fruits, vegetables, and then watching whether the urine becomes lighter and the odor improves. Now here comes the first pattern interrupt. If your urine smells strong only in the morning, then improves through the day, that often points toward concentration. But if it smells strong all day, every day, even when you are drinking normally, that deserves more attention. Remember when I mentioned that the pattern is the message? This is what I mean. A temporary smell after a dry day is one thing. A persistent smell that keeps returning is another. Now let's move to the second smell, and this one surprises people. Sometimes urine smells different because of something completely harmless. Food chemistry. Asparagus is the famous example. You may eat asparagus at dinner, and a few hours later your urine smells sulfur-like, sharp, or strange. You might think something is wrong, but in many cases it is simply the way your body breaks down compounds in asparagus. Those compounds enter the bloodstream. The kidneys filter them. Then they leave through urine. Some people produce a strong smell, some produce less, and some people cannot smell it well at all. You won't believe how much confusion this causes. One person eats asparagus and smells nothing. Another eats the same meal and thinks they have a medical problem by midnight. The difference is not always the bladder. Sometimes it is genetics and odor perception. Coffee can do something similar. Garlic, onions, certain spices, and some high-dose vitamins can also change the smell. B vitamins, especially, can change both urine color and odor when the body removes what it does not need. This is why timing is your first clue. If the smell appears after a specific food, vitamin, or new supplement, then fades within a day or two, it is usually less concerning. But here's the shocking part. People often ignore timing and jump straight to fear. They smell something unusual, assume infection, and sometimes even take leftover antibiotics. That is a mistake. Antibiotics are not harmless candy. They can disturb the gut microbiome, cause side effects, and make future infections harder to treat if used unnecessarily. So do not treat a smell with guesses. Treat the pattern with intelligence. Now let's talk about the third smell, the foul, cloudy, infected smell. This is where the stakes rise. A urinary tract infection happens when bacteria enter part of the urinary system, often the bladder. The bladder lining becomes irritated, and your immune system sends in an inflammatory response. In plain language, inflammation is your body's alarm system. Now, inflammation is not always bad. Acute inflammation is how your body fights invaders and repairs damage. But when bacteria are involved, that emergency alarm can create burning, urgency, pressure, and pain. Some people describe it like this. They keep rushing to the bathroom, but only a few drops come out. Others feel a heavy ache low in the belly. Some notice cloudy urine, blood, or a strong foul smell. But wait for it, because this is where many older adults are misled. A strong smell alone does not automatically mean a true infection. Some older adults can have bacteria in the urine without symptoms. This is called asymptomatic bacteriuria. That means bacteria are present, but there is no burning, no urgency, no fever, and no clear bladder symptoms. The truth is, treating bacteria without symptoms can sometimes do more harm than good. The goal is not to sterilize every urine test. The goal is to treat real illness. So here is the rule Dr. Leana wants you to remember. We do not treat a smell by itself. We evaluate a pattern. Does the smell come with burning? Does it come with urgency? Does it come with pelvic pain, blood, fever, chills, back pain, vomiting, sudden weakness, or new confusion? That combination matters far more than odor alone. Here's a story that explains it. Imagine two people over 70. The first has strong-smelling urine after a hot day, no pain, and feels fine. The second has foul-smelling urine with burning, fever, and pain on one side of the back. Those are not the same situation. One may be concentration. The other may be an infection moving toward the kidneys. And kidney involvement is where things can become serious. Fever, chills, side or back pain, nausea, vomiting, and feeling very unwell should not be brushed aside. In an older adult, sudden confusion or a rapid change in function can also be a warning sign. This is why the phrase, "it is probably just a UTI," can be dangerous. A mild bladder infection is one thing. A kidney infection or spreading infection is another. The body may start with a whisper, but it can become a shout. Now let's move to the fourth smell, and this one may be the most emotionally important. Sweet, fruity, or unusually sugary urine. If you hear nothing else today, hear this. Sweet-smelling urine can sometimes be linked to excess sugar in the urine. Normally, your body tries to keep glucose in the blood so your cells can use it for energy. But when blood sugar rises high enough, the kidneys may start pushing some of that glucose into the urine. It is like a sink overflowing. The body is trying to remove what it cannot manage. This can happen in uncontrolled diabetes, undiagnosed diabetes, or during illness when blood sugar rises higher than usual. And after 50, this matters because blood sugar can climb quietly for years before someone feels truly sick. But here is the deeper danger. Sometimes a fruity smell is not just glucose. It may involve ketones. Ketones are acidic fuel byproducts made when the body burns fat rapidly because cells are not getting enough usable sugar. In small amounts, ketones can occur during fasting or low-carbohydrate eating. But in diabetes, especially when insulin is too low, ketones can become dangerous. This can lead to diabetic ketoacidosis, often called DKA. That is not a home remedy situation. That is a medical emergency. The warning signs can include extreme thirst, frequent urination, nausea, vomiting, abdominal pain, weakness, deep or difficult breathing, fruity breath, confusion, and feeling severely ill. You won't believe how many people try to explain these symptoms away. They say, "I am just tired. Maybe I ate something wrong. Maybe I need more water." But if diabetes is involved and ketones are rising, waiting can be dangerous. So if someone has diabetes or may have diabetes and notices sweet or fruity urine along with thirst, frequent urination, vomiting, confusion, weight loss, fruity breath, or severe weakness, they should seek urgent medical help. Remember when I mentioned that urine is a report from the bloodstream? This is one of the clearest examples. The smell may be coming from a fuel problem inside the body. Your cells are trying to use energy. Insulin is the key that helps glucose enter many cells. When that system is not working properly, sugar can build up in the blood, spill into the urine, and change the body's chemistry. That is why this smell deserves respect. Now let's talk about the fifth category, the less common but important smells and situations. These do not happen to everyone, but when they do, they matter. Kidney stones can change the urinary pattern, especially if they irritate tissue or contribute to infection. A stone can cause severe pain in the side or back, pain that comes in waves, nausea, vomiting, blood in the urine, or pain that moves toward the groin. That is not just a smell problem. That is a urinary tract under stress. For men, prostate changes can also matter. An enlarged prostate can make it harder to fully empty the bladder. When urine sits longer, bacteria may have more opportunity to grow, and the bladder can become irritated. A prostate infection can cause urinary pain, pelvic discomfort, fever, difficulty urinating, or feeling ill. So in men over 50, urine odor plus weak stream, incomplete emptying, fever, or pelvic pain should not be ignored. For women after menopause, there is another layer. Lower estrogen can change the tissues around the urethra and vagina. The tissues may become thinner, drier, and more easily irritated. Sometimes what seems like urine odor is not actually coming from the urine at all. It may be vaginal odor from bacterial vaginosis, yeast, or another infection. That distinction matters because the treatment is different. Here is the shocking part. Many people treat the wrong problem because they assume every odor in that area is urine. But the body is more complex than that. There are also less common causes involving liver disease, kidney disease, and rare metabolic conditions. These are not the first explanation for most people, but persistent, unexplained odor deserves medical evaluation. Now let's bring everything together with the 3-secret filter. This is the part I want you to remember the next time you notice a change. Secret number 1, ask what changed before the smell. Did you eat asparagus, garlic, onions, or spicy food? Did you drink more coffee? Did you start a new vitamin, supplement, or medication? Did you sweat more? Did you drink less? Did you hold urine for a long time? If the odor has a clear trigger and fades quickly, that is often reassuring. Secret number 2, ask whether the smell is traveling with symptoms. Burning changes the meaning. Urgency changes the meaning. Blood changes the meaning. Fever changes the meaning. Back pain changes the meaning. Vomiting changes the meaning. Confusion changes the meaning. The smell is the clue. The company it keeps is the warning. Secret number 3, ask whether it is persistent or repeating. A smell that appears once after a meal is one story. A smell that keeps returning for a week without explanation is another. A smell that comes with worsening fatigue, thirst, weight loss, or pain needs attention. But here is the biggest mistake people make. They wait for pain before they listen. Urine can change before pain. Blood sugar can rise before crisis. Dehydration can build before collapse. Infection can irritate the bladder before it becomes severe. The body often gives early whispers. The wise person listens before the shout. Now, what should you actually do? First, do not panic. Panic makes people do strange things. They overdrink water, take random supplements, use leftover antibiotics, or ignore serious symptoms because they are embarrassed. Second, track the pattern for a short time if you feel well. Notice the color. Notice the timing. Notice foods, vitamins, medications, coffee, sweating, and fluid intake. Notice whether the odor improves with steady hydration. Third, know when to get help. If there is burning, urgency, blood, fever, chills, back or side pain, vomiting, severe weakness, new confusion, or a sudden decline, do not keep guessing. If there is sweet or fruity odor with excessive thirst, frequent urination, vomiting, belly pain, deep breathing, fruity breath, confusion, or known diabetes, treat that as urgent. And if the odor is persistent for several days without an obvious cause, especially after 50, it is reasonable to talk with a healthcare professional. Not because every smell is dangerous, but because persistent signals deserve respect. The truth is, urine odor is not embarrassing. It is biology. Your body is showing you information from hydration, metabolism, infection risk, food chemistry, medications, and waste clearance. And here is the final mini-climax. The goal is not to become afraid of every bathroom visit. The goal is to become observant. Because there is a difference between fear and awareness. Fear says, something must be terribly wrong. Awareness says, let me notice the pattern and respond wisely. Fear makes you ignore or overreact. Awareness helps you make the right decision sooner. So the next time your urine smells different, do not just flush and forget. Pause for a moment. Ask, what changed? How long has this been happening? What other symptoms are present? Those 3 questions can separate harmless odor from a warning sign. Let's recap. A sharp ammonia-like smell often points to concentrated urine, especially if you have not had enough fluid. Food smells can come from asparagus, coffee, garlic, onions, spices, and vitamins. Foul odor with burning, urgency, fever, blood, or back pain may suggest infection and should be checked. Sweet or fruity odor deserves special attention because it may be connected to blood sugar or ketones, especially in people with diabetes. Persistent, unexplained odor or odor with pain, weakness, confusion, vomiting, or severe thirst should not be ignored. Food and hydration can support urinary health, but they do not replace medical care for infections, diabetes emergencies, kidney disease, prostate problems, or other serious conditions. So here is Dr. Leana's bottom line. Your urine can change smell before you feel pain. Sometimes it is harmless. Sometimes it is hydration. Sometimes it is food. Sometimes it is infection. And sometimes it is a deeper signal from your metabolism or urinary tract. The smell is the clue. The pattern is the message. Pay attention without panic. Track the signs. Respect the red flags. And when your body whispers repeatedly, do not wait for it to scream. If you have noticed urine smell changes after certain foods, vitamins, coffee, medications, or dehydration, write your experience in the comments. Your story may help someone else recognize a pattern they have been ignoring. And if this helped you understand your body better, like this video, subscribe to our channel, and share it with someone over 50 who needs to stop dismissing the small warning signs.